What is tendinitis in the knee, and what do you need to do to get rid of it? I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Tendinitis is inflammation of a tendon. Tendons are the fibrous cords or bands that connect muscles to bones. When tendinitis occurs, the tendon becomes swollen and painful. The most common location for tendinitis is in the knees, although it can occur in other areas of the body, like your ankle or elbow. The most common causes of tendinitis in the knee are overuse. With sports or exercise, it's usually jumping or running. The tendon can also be injured by turning, squatting, or kneeling on it repeatedly. The symptoms of tendinitis in the knee include pain in the front of your knee, especially when you bend it or straighten it, pain when you run or jump, stiffness in the muscles around your knee. The diagnosis of tendinitis is made by physical exam by the doctor or orthopedic surgeon. In some cases, further tests like an MRI or ultrasound can be performed to confirm the diagnosis. Treatment for tendinitis is based on how severe it is, how severe your symptoms are. It can be treated with rest, ice, anti-inflammatory medications like ibuprofen. Your doctor may also recommend physical therapy to strengthen the surrounding muscles and help support the tendon. In some cases, injections are given directly into the area where you have pain. Now, cortisone shots are harmful to tendons and you should definitely avoid those. But there are other injections that can help the tendon heal without harming the tissue. Surgery, fortunately, is very rarely needed for knee tendinitis. Again, knee tendinitis, a very common problem that can cause pain, swelling, and stiffness in the joint. It's usually treated with rest, ice, anti-inflammatory medications like ibuprofen. If those methods don't work over 3 or 6 weeks, then maybe physical therapy or injections in the tendon itself can be helpful. I'd love to hear your experience with tendinitis or whatever your knee injury is. Leave those in the comments below. Just know that if you leave a question for me in those comments, I can't offer you medical advice, but I can try to answer your question in an upcoming video. Make sure to subscribe to my video channel. Click the bell to be notified when I release a new video and when I start another live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.